Well, folks, if my clock is correct, we have 6 p.m. and welcome to our town hall regarding our new surveillance testing that we're mandated to do by New York State. So we're up to around 130 guests tonight. So thank you for taking the time to join us. And we're going to do our best to provide information for you and answer any questions you may have. So with that, I'm your Superintendent Aaron Johnson. I have a few friends and colleagues with me tonight. So why don't we do a quick loop around the horn here? And if you guys could introduce yourself, we're going to start ladies first. Mrs. Miga.
Sure, thanks, Dr. Johnson. Hello, everyone. My name is Chrissy Miga. I'm the K-6 Director of Instruction here in West Irondequoit.
Good evening, folks. I'm Dan Fullerton. I'm the K-12 Director of Technology in West Irondequoit. Thanks for being here.
Just give me 1 minute. We have a fourth panelist, but I think he joined and needs me to promote him. So you'll see James Brennan, our Assistant Superintendent for Finance, popping up here momentarily. Mr. Brennan is also serving as our COVID-19 Safety Coordinator. Pretty tall task, and he's doing a great job. So hopefully he's going to show up on your screen here soon, if I'm doing everything right. Okay, so we're going to spend about an hour together, or as long as it takes. And a couple of things. You know, we're doing a webinar, so everyone right now, you are on mute and you're not showing your video. But if you have a question as we're going through a conversation tonight, got a couple of options. You can place your question in the Q&A. Please do that rather than the chat, because then I can copy that and save it, and we can add to our FAQ if we need to. So you can post your question there, and I see one that's already up. Or if you want to post your name, I'm more than happy to allow you to talk during this presentation. And you can ask your question directly to our panel here, and we can have a quick chat that way as well. So I'm going to kind of kick it off. And what we have here, we prepared some just basic slides based on our thought exchange. Kudos to our community. We had a great response rate with our thought exchange. I'm going to share some of that here in a minute. But you know, this whole micro cluster strategy has been somewhat complicated, as most of the things related to COVID and New York State. It's changed over time and evolved. We're happy to change with those times, and actually it's ended in a pretty fair place from my perspective. So I'm going to bring up the PowerPoint and we'll get this party started. Okay, so can you guys see that? Big thumbs up? Okay. So again, as I said, we're here tonight to talk about the surveillance testing that we're doing now that we have been designated a yellow zone. And most of you know that that happened last Monday, and that's going to be important here as we work through this. I'm just going to start out here by just talking a little bit about that microcluster strategy, okay? So this was rolled out, gosh, I think sometime in October, but kind of flew past most of us because at that point, our 7-day rolling positivity rate was pretty low. But it's very quickly become very real to us. So you can see here, and we put this on our website, thanks to our Public Information Director, Jeff DeVeronica, and Pat Hartman. We have a lot of information up there, but this is all on our website. And you can see right now, we're in a yellow zone. And that's a little confusing for folks because if you're watching the news, our 7-day rolling average is much higher than 3%, okay? But the governor has not changed our designation. At any given time, he could change our designation to an orange or a red, and you can see the metrics for that here in these columns. But what it means to be in a yellow zone, I'm just going to go to the next slide because you can go back to this on our website at any time. I just wanted to call your attention to that. Is that initially it meant that any schools that fall within that yellow zone must test 20% of our in-person students and that should say staff weekly. I'm sorry, that was a little typo. And so, that was a big conversation out of the box. What if you don't consent? Should there be consent? And I know there was a conversation going back and forth around our community about that. And right from the get-go, we chose, as I think we should, to offer the option for parents to consent, because I think this is always your right with something related to your child's health. And we chose to approach it with our staff as taking the volunteers first, okay? And initially, the state said that every week we would have to test a new and unique group of students and staff until we go all the way through our student body and our staff. And then on our 6th week, come back to our first cohort. And it's got to be random. So that left many schools scratching their heads. How are we going to do that? Especially if people don't provide consent or unwilling to partake in the testing. And then as part of that initial direction, the testing would continue within your region, a yellow region, until you're declassified from that zone, or until your region is elevated to an orange or a red. Again, I kind of skipped over that with the orange and the red, and I think that's important to call your attention to as well. If we were designated to be an orange zone or a red zone, okay, based on the 7-day rolling average, that would mean that as soon as that designation was declared, we would have to operate fully remote for at least 4 days. And to bring any students and staff back, everyone would have to test negative prior to coming back. So we've had some conversations around that. So what does that mean? And for West Irondequoit, we've had this conversation before around the shift from hybrid to remote and remote to hybrid, and what we can and cannot offer just based on staffing limitations. And if we were in an orange or a red zone, we would have to either be one or the other. Like we would have to have everybody either agree to test so that we could bring everybody back after the 4 days, or we would have to go fully remote. And I just want to put that out there. And that's really because of the staffing limitations. And even if financially we could add staff, the staff just aren't available. There's a real drought and a staffing shortage regionally with qualified people and willing people, to be honest with you. So that's that. Hopefully we never find ourselves in that situation. But that's going to, again, be determined by us as community residents here. So we got some guidance. It started coming in last week and was finalized on the 14th, so over the weekend. DOH provided this update. Rather than schools testing every week, we would have to test 20% of our students and staff within the yellow zone within 2 weeks of the initial declaration. Like I said, that first day is going to be important for us, and that was November 9th. So last week has come and gone. So we're actually in the 2nd week. So we have to complete all of our testing really by next Monday. So our last day to test students and staff is this Friday. And if our school's positivity rate is below the current yellow zone 7-day average, so our current 7-day average, because we have not been, the governor has not declared us an orange or a red zone yet. If we fall below that as a school district, there's no further testing, okay? So that would be great. And right now, we have more than enough staff that have volunteered, and we have plenty of students to cover that 20%, okay? So, Mr. Brennan, you prepared to talk a little bit, just give some quick nuggets about where we're at with the testing schedule and some of the logistics?
Yeah, absolutely, Dr. Johnson. Can everybody hear me okay? Just checking. Great, awesome. So yeah, as Dr. Johnson has up on the screen right now, we have been working diligently towards developing a testing schedule. As he indicated, we are in that kind of second week already, where we need to achieve the 20% mark of our staff and students. And we're going to be really focused in on our staff on Wednesday this week. Reason for that is, as you know, in our hybrid model, with some exceptions, our buildings, our kids are mostly in an asynchronous learning environment at that point, so our staff is more available to engage in the testing at the point. But we are also going to be offering at Rogers Middle School a drive-up option for our testing, and that's really targeting grades K through 3 and 4 through 6 at the times indicated there. The real thrust of that is really trying to reduce some of the load that we're going to have at the actual student testing dates on the next 2 days. Then obviously the next 2 days, you can see them up there. We were kind of differentiating when we're going to be testing based on, again, this was developed collaboratively with the building principals in terms of looking at their schedules and having trying to minimize the impact on instructional time, knowing that we're going to have to hit our 20% mark by the end of the week. So you can see K3 at those days, we're going to be looking at morning arrival times, 4 through 6, similarly during the morning meetings, that's going to be our targeted time. 7, 8 during their lunch study hall period, and then finally 9, 12. Again, they're going to be trying to target in the morning as much as possible, but recognizing that is our most populous building, most kids, so we'll probably have to continue it throughout the day. Again, trying to minimize the impact on the classes themselves.
And Mr. Brennan, can you just share approximately, just ballpark, how many students per building on average are we going to have to test per day?
Sure. So at the K through 3 levels, because we're kind of on a shortened week there, we're really going to be looking at a total of 28 kids at each of those buildings there. At the 4-6 level, we're looking at really double that number, so we're going to be in the 40s or 50s. And the numbers are similar at 7, 8 as well, a little bit larger. And then finally, the largest piece is at 9, 12. Again, biggest building, so we're going to have to hit about 100 kids per each of those 2 days.
So you may be asking yourself, if you're in the gallery, why didn't we start testing today? And some schools did, okay? One of I think the most significant factor was really getting the staffing in place. So some schools chose to contract out and are bringing in a whole unit from some local agencies that are conducting this testing. We're not doing that. We're working under and all schools really are working under the direction of the Monroe County Public Health Department, all right, who have, they are certified as laboratories. And then underneath them, we're working under our school physicians here locally, and then our nurses, and we are training staff to administer these tests. I posted a video recently. Again, this is the shallow nasal swab. And our older students, we're going to encourage them, if they feel comfortable and you have consented for them, they can swab themselves. And as you saw me do, it's in Dr. Mendoza, it's pretty easy. You know, when we get down into the middle and lower grades, we'll have trained staff to assist students with that. All right, so getting that staffing in place was pretty important. We do have some folks that are going to be volunteering to help with that, some trained medical personnel here from the community. And one of the big lifts with all of this is the data. And here in a minute, I'm going to ask Mr. Fullerton, our Director of Technology, to talk about that, because I know there was some concerns about confidentiality. And we share those concerns with you, and we want to make sure that you know your child's personally identifiable information will not be compromised. So either I can do this or you, Mr. Brennan, but when a student walks into a testing location, just give me a real quick general understanding of what they're going to see and experience.
Sure. The first thing they're going to obviously need to be, it's part of the process in terms of identifying who the kid is, so that we can obviously connect the student with the test that's ultimately going to be taken through. And then it kind of is differentiated a little bit, obviously, between the lower levels and the upper levels, but then they would have an opportunity to be familiarized themselves with the testing apparatus themselves, which consists of that swab and the kit itself. And then again, depending on their age, as appropriate, they would actually be engaged in the test themselves, whether they're going to do it themselves or whether the trained nurse there with them is going to do the testing. The test then would be then put into, basically it's a little sleeve if you watch Dr. Johnson's video, which has been activated with a reagent. And that's closed up. It takes 15 minutes. Again, we're trying not to impact instructional time, so the student would be returned to their classes at that point while the test itself is being analyzed. Again, it takes 15 minutes to do. That test is going to be recorded, and feedback would be provided to the families. In terms of, we're expecting the vast majority are going to be negative cases. So the plan right now would be an email home indicating that the test was performed that day and the result. In the instances where a student tested positive, they would be returned to the nurse's office, similar to any time we have a kid go to the nurse's office, and they would we'd be engaged in similar protocols like we deal with students who report to the nurse with COVID-like symptoms. The call would be made home, and the recommendation would be the child would be go to the see their primary care provider for further investigation. It is a diagnostic test. It's not necessarily the final test for determining COVID-19.
So when students come down, obviously they're going to be masked. We're going to maintain their physical distance when they're in the testing location. When they're actually taking the test and they're being swabbed, they're going to be behind a screen for privacy. The personnel who are taking the specimen are going to have all the appropriate PPE on. They're going to be changing gloves in between. Kids are going to sanitize their hands on the way in, on the way out. All of these protocols are things that most likely sound familiar to you as I say those, okay? So we're trying to make this an environment that, again, isn't overly alarming for students. They're going to see some friendly faces there. That was one of the important reasons why we felt we would want to staff this with our people, right? Rather than having them feel like they're walking into a laboratory setting. But we're going to try, we are going to do all of the right things to make sure that this is done correctly. The other thing I would note is that, some people have asked, well, geez, if we have a positive test, isn't that dangerous? Well, here's the thing, everybody's completing their health screen in the morning, right? So, theoretically, everybody that comes to school is asymptomatic, all right? Or showing no symptoms of COVID-19. Of course, we've had situations where students do, they do exhibit COVID-like symptoms during the day. And as Mr. Brennan said, we manage those. We have protocols in place. We take them safely to an isolation room. Well, this would be the same case. The students remain masked. We know that the mask works. It protects both the people around you and you from taking in aerosols now. We know that to be true as well. So we're going to continue to keep people masked. And then if there's a positive test, we're going to handle it the way that we've been handling those situations right along. So I can't think of anything else on this slide. I'm going to get into some of the data stuff. There's some questions that came up in the thought exchange. I'm going to turn this over to Dan Fullerton with that fancy microphone.
Thank you, Dr. Johnson. So we take personally identifiable information, data privacy and security very seriously in the district. So what we will be reporting to the New York State Department of Health's electronic clinical laboratory reporting system, the same system any lab doing these COVID testing work would be reporting to, would be basic identifying information: name, address, date of birth, phone, and school attended. In addition, there is a couple columns of information for race, ethnic group, and gender. If that's not filled in, you can still upload the data. That's information we already have inside our student tracking system. And then that a test was administered and what the test result is. So that's what goes into the state's Department of Health reporting system. What we keep in the district is that same information except for the test result. So once it's submitted, we just have the test date. That allows us to help track to make sure that we are not testing the same student over and over and over again, and help spread our random 20% testing across our entire body of consenting students.
Thank you. One quick note, Mr. Fullerton. We had a conversation about this today. So you got the tests. People saw that when I modeled that, you got a box, right? That is that sleeve that Mr. Brennan mentioned. Is there going to be any personally identifiable information on that sleeve that will connect back to a student when those are discarded of?
Thank you for bringing that up. As we do the tests, in order to keep track of the test packet along with the student information, we will be taping the student information onto that packet physically long enough to make sure that we verify what test goes along with what student. Prior to destroying the test, we will be pulling that information off. So anything that's discarded, there is no further way to track and do a correlation between the individual student and the test. So in that manner, we are de-identifying any test results beyond the one place where it's reported to the state reporting system.
And then you and your data team, you guys input the data, and afterwards those sheets get shredded, right?
Those sheets then get destroyed. Yes.
Thank you.
Just another sheet showing the same information uploaded to the State Department of Health website, except the only thing we take from a medical standpoint would be the date the test was administered. Everything else is the exact same. The identifying information we already have stored by the school to track each individual student.
So one piece I didn't mention when we were talking about the testing schedule, but I'm going to jump in and use this as an opportunity. People had asked, parents said, hey, you know what? I'm not totally comfortable with this, but if I was able to be there, I would consent to my child being tested. So we set up the consent form, and you may have noticed in the FAQ that we posted, we are inviting parents, if they want to be there and present and possibly take the specimen if that's what they choose to do, especially with our younger students, you know. And so you can contact your child's building principal directly to set that up, okay? And they're taking names, and then if your child's in that 20% that's selected randomly from people that consent, they will schedule that. Or you can come, this is an important reason why we set up the Wednesday drive-up. I think it'll be much more convenient for many folks to just sign up for one of those times based on your building, and then just bring your child there. And so there'll be a form, like Mr. Fullerton had said, where you can fill out all that information. You give it to the person at the test site. They give you the swabs. You guys can do that. And then we take that test. And again, whether it's the drive-up site or during the school day, people are going to be sent on their way, kids back to class, families can go home, and then we will follow up with a letter indicating that the test was administered and that your child had a negative result. If it's positive, you'll get a personal phone call from one of our administrators or one of our nurses. Am I leaving anything else so far in the testing before we get into some of the questions around the instructional program? Okay. Ms. Miga, there's some questions around continuity of instruction and what's going to happen if we are directed into a fully remote learning model.
Sure. So certainly coming into this school year, and as we've been working through it, this is something we've been preparing for, given our closure that we had in the spring of last year through the end of the year. And so we have been working closely to make sure that our instructional programs are ready to move to remote if that was an option at any point during this year. So we continue to do that with our teachers and staff. And just a couple of points to keep in mind if that is something that we need to do. First and foremost, we have a goal of preserving that instructional program as best as we can. And so in many ways, it will mirror the in-person instruction that your child is receiving, of course, to the extent possible. We know that you can't just completely recreate something in a remote setting that's being done in an in-person setting. But that will include, of course, the synchronous and asynchronous instruction that's occurring. Wednesdays will remain the same. We know that might be a question for some of you as you are working through schedules and thinking about that. So asynchronous at the K-6 level, and then mainly asynchronous with some different opportunities for synchronous at the 7-12 level. From the thought exchange as well, we had some questions too about switching your learning model. We just wanted to put a reminder out there that you can still submit a form. We've just made the switch for our first 10-week marking period for students to switch either from the hybrid model to the remote model or vice versa. And so if you would like to think about that switch and you've made that decision, we'd love for you to put that request into the forms that are on our district webpage by December 21st. So we realize there's many moving parts to this school year, but we are asking if you're able to fill out that form to please do so. It helps us to organize and really, as this slide says, ensure that continuity of instruction. So if you have questions, please don't hesitate. You can reach out to me by either phone or email, and I'm happy to talk through some of those pieces, as well as our 7-12 Director of Instruction, Karen Finter. And so that just gives you a little bit of a taste of what to expect if we go to remote. It's what we're preparing for. We'll be able to, if needed, we'll be able to communicate schedules and information for your teacher through the different learning management systems, and really do our best and do what we need to do to ensure that continuity of instruction.
Thanks, Mrs. Miga.
Mm-hmm.
So again, I just got to reiterate, we as a community have the power to keep our students in school here. So we're going to do this testing, and I am totally grateful and appreciative of the folks who stepped up and are willing to consent and volunteer for this mandatory testing. So we're going to get that done. And there's no doubt in my mind that our positivity rates are going to be far below the current 7-day average, far below. All right. But what we have to attack here is the 7-day average. And so with Thanksgiving coming up, I know that, look, hey, you got your traditions and your plans, and I'm certainly not in any position to step into the middle of that or direct people. But all I ask is this, I know how much Western Irondequoit cares for its children and schools. And so if you're gathering, just please make sure that you're taking the precautions with the masking, with the physical distancing as you can to the best of your ability, and just the hygiene. Last thing we want to do is to see that infection rate spike after Thanksgiving. So with that, just got a reminder that with the remote testing that or the drive-up testing that we're going to do on Wednesday, information is going to go out to families tomorrow. So if you're a parent of a K-6 child, you'll have an opportunity to complete a form indicating that you're going to take part in that. And then you'll have a form that you can print out to fill out with your child's information to bring to the test location. And we'll have some hard copies of that form there in case you're not able to print that out. Totally fine. But what that's going to do is, number one, it's going to give you an opportunity to do that together. And then number two, it's going to draw off a certain number of children to lighten the load during the school day. So our nurses are working very hard. You'll probably notice that we don't have any nurses on our panel tonight, and that's by design. Our head nurse, Mary Piston, who's been fabulous through this whole thing, is actually attending a webinar with Dr. Mendoza tonight on our behalf. So thanks, Mary, for doing that. And today, Mr. DeVeronica put out on social media a great tribute to our nurses. So I just want to just say it formally, that those folks are doing an outstanding job in a very, very tough situation. So again, I want to leave time for the open questions, but I'm going to get into the thought exchange because that's where some of the questions, well, the questions came from that helped us to design that slide deck right there. So we sent the thought exchange out about a week ago, give or take. We had 722 participants, 718 thoughts, and over 20,000 ratings. So a really great showing by the community. Some of the general themes, I mean, people, number one, were very complimentary. They were talking about, obviously, the testing, how we're going to administer that, the staff, opting out, can the parents be there? There's some questions around the rapid test, the false positives, which we'll get into. And then I don't remember what the kids part was there. But what I did was I printed off the top 20 thoughts, top 20 most highly rated thoughts. Here's the top 4, okay? And I'm putting them up there because, again, very complimentary of our staff and our community. And we're in this together. I keep saying that. Hopefully it's not getting hokey. But without one another, we would be lost. And that goes for you folks at home as well. Very, very important part of this journey. And then these were 2 of the top 6 about the personally identifiable information. And Mr. Fullerton, you read those. Is there anything, actually there's 3 there, anything that we left out that you want to speak to?
As far as safeguarding medical information gathered in accordance with HIPAA, number one, we are trying to minimize the data we are gathering other than what's recorded for the state and then destroying information so we don't have HIPAA related information in the district. How is medical privacy going to be protected? If a child's called down for testing and doesn't return, everyone would be made aware that they had a positive test. That's a tricky one, and I'm not sure I have a good answer for that one at the moment, other than students are fairly regularly called down from classes for a variety of reasons that's not necessarily a medical related. So I don't know if that automatically lets everybody know that they had a positive test.
Yeah, I'll jump in there. I think that's a very good answer, Mr. Fullerton, and you should give yourself some kudos there. That's exactly it. I mean, that's the reason why we're not holding students that test positive back at the test location, because when everybody returns to class, they would stick out like a sore thumb, right? And so, as Mr. Fullerton said, very frequently during the school day, for whatever reason, students are either called out or grabbed for, it could be for some type of support. It could be for, for some counseling needs or to get called down to the office. Maybe a parent brought in some materials for them. Maybe they forgot their lunch. It could be a number of reasons why students are called out. And so if we're able to do that in a delicate way, we're not putting that target on that child's back. And like we said, we're going to handle those situations as we have been with students who become symptomatic during the school day. So give yourself a 3 stars, Mr. Fullerton. That was a great answer. Anything else?
Thanks. And the last one, what other information are we sending to the government? That's the name, address, phone, the subgroup information, race and ethnic group, as well as gender, and finally the test date. So that's the other information that's disclosed as part of the requirement for our lab upload.
I'm gonna elevate your status to a 5-star after that. Nice job. Okay, next set. So here's a couple of the other questions that came up in the top 20 most highly rated thoughts. So how accurate are the rapid tests? And I saw some things getting kicked around social media today around the false positives. And is this test rated for symptomatic, and is it rated and approved for asymptomatic? Well, you know, shooting straight, this test was designed for symptomatic individuals. And again, this is why we have the health screen and the daily temperature check, right? For our students and staff. And so if somebody tests positive, okay, that is an indication that the parents should then, or the staff member should then, report to their healthcare provider or to a clinic to get a follow-up test, okay? So if your child or a staff member tests positive here at school, all right, we're not going to consider that necessarily a positive test. We have to report it that way, but we're going to tell you, we're going to direct you to seek out your healthcare provider or go to a clinic and have a follow-up test, just like we would if a student becomes or a staff member becomes symptomatic during the school day, okay? And then what's the rate of false negatives? Is the test sensitive enough to pick it up in asymptomatic individuals? And again, based on the research I did, the information that's out there is not 100% clear on the asymptomatic individuals because it hasn't been FDA approved for asymptomatic individuals. Again, this is a surveillance test. That's why New York State is calling this a surveillance test for COVID-19. And if anyone feels because of a close contact or because of a symptom that they should be tested by their healthcare provider, we encourage you to do that, okay? This is strictly surveillance testing. That's my slide deck. So why don't we take a look at the Q&A, folks, and see what we've missed. So I see that must be Mr. DeVeronica is going through and answering some of these, and hopefully I don't address ones that he's already answered. First question: why was there no place on the consent form to indicate you would like a parent present? I don't know. We probably should have put that on there. And I think in our conversation, we did discuss that, but it ended up being in our FAQ that we asked parents to contact their building principal. So I apologize if there was any confusion and misdirection with that, and hopefully we've clarified that. Please make sure that you contact your building principal at this point. They are totally aware and waiting for those emails or calls, and they're going to accommodate your needs and wishes as parents. Mr. Fullerton, did you just say you wanted to answer something live?
Sorry, I opted into answer live as you were speaking there.
Okay. What percentage in the community would close schools? Well, I've been talking a lot, so I'm going to give Mr. Brennan. You want to address this one so that people don't have to, we break up my voice a little bit here?
Sure. Yeah. I mean, it kind of goes back to your slides regarding the orange and red zones in some respects. That's really the current guidance that the states put out. The 4% numbers, the number that's been running out there for community our size for the orange zone, which would require us to shut down at least for a period of time, 4 days, and then get engaged in the testing. And I believe the red zone is 5%, if I'm remembering correctly. that kind of guidance has evolved though, because it used to, if I remember right, going into the school year, was kind of a hard number where schools were just shut down, period. And I think as they've kind of learned through the process of the pandemic, I think this is where the ideas of these targeted focus areas came into being, because a lot of the data they have so far has been showing that the prevalence of the spread within the schools is extremely low. So I think that's why they're kind of, instead of just saying, if you hit a number, schools are just shut down. That's where I think it's been kind of an evolution in terms of those numbers, and that's where these orange, yellow, and red zones came from.
100%. And so I think that they fully agree that our schools are the safest place in the community. They want to support us in keeping our schools open for you and your children. And we're hopefully going to be able to provide the 20% testing to make that happen. But technically speaking, right now, we are living in an orange zone, very quickly approaching a red zone. And the only thing that separates us from that is the governor's declaration. If a parent opts their child out of testing, does that mean the child needs to go to remote-only learning, or can the student still remain in the hybrid? Chrissy, Miga, would you like to field this one?
Sure. If a student opts out of testing at this time, they would stay in their current learning model. So they would stay in hybrid if they're in hybrid.
You got it. And I know that there's some counties close to us. There in some schools in those counties, if people opt out, they're not allowed back in school. That's not our stance on this. We want our kids in school. If parents don't consent, can they still send? So that's kind of the same thing. And I think there's a question about if a parent doesn't consent, at some point, could they change their mind, or vice versa? And the answer is yes. Okay. That's not set in stone. So if you change your mind and want to have your student and want to give your student consent, you can do that, even after tomorrow's deadline. Or if you want to switch back, that's fine. How's a student's privacy going to be protected? I think we answered that. For example, 3 students are pulled from class to test, 1 test positive, so only 2 return. I think we addressed that. Mr. Fullerton, anything to add on that? Okay. How accurate is the test going to be if a student swabs him or herself? Honestly, it's going to be just as accurate as whether one of our trained staff do that, because it only has to go very shallowly into the nostril. And when you pull it out, you'll know if you have the mucus on there for the test, and you don't need much. And so our people are going to be overseeing that, our trained folks. And if they don't think that there's enough on there, they'll just have them re-swab. So we'll ensure the accuracy for that. Is this going to be an LPN or RN administering the test? That's going to be dependent on the circumstances in the building. They do not need to be an RN or an LPN, okay? According to the guidance from Dr. Mendoza in the Public Health Department, they simply have to be trained. And we have the training happening tomorrow. Again, one of the reasons why we're delaying the start to Wednesday. We have our registered nurse, right, Mr. Brennan, coming in and working with our staff.
Actually, it's our nurse practitioner.
Right.
Yep.
Yes, nurse practitioner. Thanks for the correction. Yep. Nurse practitioner coming in to do that. And then our nurses, if they're not administering, they're going to be overseeing that process in all of our buildings. And then, like I said, our school physician will be overseeing them. Next question. I'm curious if the district tests with a low percentage below 3%, but the county continues to go up into the orange zone. Have they given guidance if schools will still be required to go fully remote? Also, while I'm grateful to see we won't have repeat testing if we remain a yellow zone, is there a time frame for when they could ask our district to test again? So our state has been rather unpredictable. And again, we're considered a yellow zone right now. So we're going to, we're being held to those standards. Our numbers reflect that of an orange. The governor could declare that, and we would have to follow those protocol. But for right now, we're a yellow zone. And I think that based on their reflection and their conversations, they're doing everything they can to keep our schools open by giving us this opportunity to test that 20%. Next question. If you are informed ahead of time that your child is going to test that week and they're K through 3, can you choose to drive up with them on Wednesdays instead of being tested in person? Yes, 100%. Even if they do in-person instruction, yes. So the only, and this is an important clarification, we are only required to test people that are in person. We do not have to test any of our students who are working in the fully remote model, okay? And again, if everything goes well, this is the one time we'll have to test people. How do you ensure confidentiality when a student who tests positive will be sent home immediately, followed by an extended absence? It will be obvious to staff. Well, those are the procedures now. So we have students and staff on quarantine, and we have students and staff in isolation, right? I mean, we've been living with this gradual increase in those types of situations since the beginning of the year. And we don't do anything to share any personally identifiable information which would identify those people. But again, they won't be in school, and that's a fact. But that could be the case, if they were just sick in any other given year. So there isn't a way that we can ensure that people will not assume that that's why they are absent. But that is currently the situation as well. And we do have, thanks to the support of our community and Board of Education, we do have a COVID-19 counselor, a part-time counselor who works with our families and students to support them. And those are some of the ways that that person is supporting them, along with our new coordinator of counseling, student equity, and wellness. And so if you have any concerns, please reach out to either your school counselor or your building principal, and we will support your child and family to make sure that it's a smooth transition back into school. If there's a need to continue testing, has any thought been given to expanding the drive-through options? Mr. Brennan, you want to talk about that?
Yeah, I mean, that's a great question. Obviously, we're kind of building the plane a little bit as we're flying it. But yeah, I mean, the drive-through option came up as a way to alleviate some of the pressure on the buildings and address the concerns from parents in terms of the desire, understandable desire of wanting to be there for some parents with their kids during the testing. But I could definitely see that model being applied if we went into an orange or red zone, because we would have to engage in quite a bit more testing. So I could envision perhaps during those 4 days of required closure of utilizing a mechanism like that to get that testing started to move towards meeting that guideline.
Yeah, and in fact, Mr. Brennan, we were talking with our planning team about adding weekends if we had to sustain the testing, like at least some period of time on a Saturday when people could do that. So if that becomes the case, it's highly likely that will be the scenario. The updates we receive states that they do not disclose the student's medical diagnosis other than reporting to the public health department. Does the school faculty know and have access to that medical information? How can you guarantee and secure the privacy? Our faculty and staff do not have access to that. Just like stated there, We don't have a right to give them that. And so that is confidential to the nurse, to the people that are inputting that data, Mr. Fullerton and his team, and likely the building administrator and possibly the school counselor if they're involved in some of the supports. But that is not shared with our staff at large in any way, currently or in the testing that we're about to enter into. Mr. Fullerton, anything to add?
We strongly follow the principle of least privilege, where only those who absolutely need to have access to that information do. If it's not absolutely required for a job function or the safety of the student, it isn't shared any further.
And I should note that Mr. Fullerton's here tonight with our data, not only because he's our Director of Technology, but he is our Ed Law 2D, and help me get the title correct. What do we have to designate you as?
Data Protection Officer.
Data Protection Officer. So this is literally his responsibility. And he's doing a great job with that. Some of the younger students may have had the COVID test already and may have strong feelings and anxieties. What is the protocol to handle the situation if the student is extremely anxious, overwhelmed, and it is difficult to properly perform the nasal test? And they don't have to do it. You know, and we understand that. We have more than enough people who have volunteered for the first round. And so again, we respect that. We don't want to traumatize children here. And that was some of the mixed feelings we were having if we were forced to test our students over a extended period of time. We're not in the business of traumatizing children. What's on the QR code? I don't know.
Not a clue and haven't scanned it yet.
Which QR code? The one in the box? Is that
Yeah, I think they're referring to the QR code on the box, and I'll take a stab at it. I think it's related to other settings where they use these tests. There are apps associated with it in which you can get your results. Kind of with our limited in use piece, we're doing kind of a more personal approach with the phone call in the case of a positive test, or an email in the case of a negative test. So I believe that's the QR codes related to the app.
Thanks, James. And I did try to scan it when I did the test, and it didn't scan. Must be for that reason, James. We just don't have the system, and we're not inputting the data into a system that would allow us to use that. What staff type is trained to administer this test at each grade level? Mr. Brennan, you want to tackle that one?
Sure. Obviously, our nursing staff is being trained in it, first of all. And then there's a variety of other individuals that are also going to be tested. And as Dr. Johnson indicates, it's going to vary a bit by building, and also in terms of the volume of the tests that have to be done. So our building principals will be tested as well as some of our other health office staff. And then we're also working with, as I believe mentioned earlier in it, with some volunteer medical personnel from within our school community. So there'll be some testing involved in that. The important thing to recognize is within whatever testing or whomever does the testing, we're following testing materials prescribed to us by the Monroe County Health Department. The training itself is being overseen by our licensed nurse practitioner. Our school doctor is serving as our overall laboratory director. It's kind of overlooking over all the testing procedures in place. And then obviously we have an excellent cadre of nurses in our buildings to assist with all that.
So I want to make it clear when we talk about people that are volunteering, those are physicians and pediatricians who felt strongly about supporting keeping our students in school. They will not be involved in the data portion, okay? Nobody will be, except for our people as part of Mr. Fullerton's data team. What they would be involved in is simply helping to administer the test and collect specimens as needed. And again, these are people that are vetted, who are fingerprinted because they're working in the medical field, either at that level of doctor or pediatrician. So when they reached out and we were looking at being able to manage that, that was an attractive option that we pursued. Outside of those folks, and like I said, there's probably 4 or 5, we do not have any other volunteers involved. We are considering actually adding some nurse services if we're asked to sustain this through some local services, similar to some of the other schools that are using those now. But because it's not going to be sustained, we chose not to go in that direction yet. I already talked about the switching the remote. For the Wednesday night drive up, could other family members also be tested along with the student? It's a great question. Well, if we're talking parents, then that's not the purpose of this surveillance testing for our school. If you're talking about other students, then yes. So I didn't mention that, but if you have multiple children in the district, and let's say that maybe you have children who are consenting that are older than grade 6, bring them. Yeah, we'll figure it out. We'll have them test. Mr. Fullerton and his staff will make sure that that data gets to the right building confidentially and is added to that group for reporting. Again, it's that whole idea that will draw some people up. We don't want to inundate our testing sites, but if there's a few families like that, we'll manage. Does the testing have to be distributed so that it's 20% of staff, 20% of students, and then distributed so that it's 20% K-6, 20% 7-12? James, you want to field this one?
That's a great question. So what we report right now are in terms of the number of staff and students by building in person. And so our understanding of meeting that 20% requirement from New York State in terms of the yellow zone designation is essentially to match 20% proportions of the staff and students within those buildings as well. So it'd be a building by building piece, 20% staff and building and 20% of students in that building in person. It's essentially, they have the information already for us in terms of how many people we have in those buildings in an in-person setting, and they're going to be looking for how many people we tested at the end of that 2-week period within those same buildings.
Beautiful. And I'm watching the clock. It's almost 7 o'clock, but we're going to go through all these questions because you took the time to come here tonight. We want to make sure that we take the time to answer your questions. So it's a good one. When will students and staff be notified of being selected? I could field this one, but I'm going to kick it to Mr. Fullerton because we had a great conversation about this today.
Sounds good. Staff will be notified on Wednesdays on the staff testing day and then be able to come down to the testing location in the individual building throughout the day to get their test done. For students, from a logistics standpoint, we are trying to select students randomly from the available pool of consenting students in a manner that minimizes disruption to instruction. So from that perspective, students will be selected just prior to the time of testing. That way as well, if we have a student who is resistant to the test, upset in any way, anxious, it gives our building leaders some flexibility to pull in additional students to take the place of those who are a little more anxious around those exams.
Yep. So when you consent, that pool of consenting students or students who have parent consent, we're going to draw a random sample from them by building, and those students are going to be called down based on those random selections. You will be notified, like I said, via an email the day of the testing once it's done, so that afternoon, to indicate that your child was tested and that it was a negative. If it was a positive, you'll get that personal phone call during the day when your child is discreetly called down to the nurse's office. Next question. We are on track to be in the orange zone on Friday if numbers continue to be as high as they are. How long would testing of all students take to return to in-person instruction after the 4-day remote period? Would every single student have to take a test in order to return? Yes. And so it's a 4-day minimum period where we're fully remote. And, we're working, this is kind of the first step in getting all the logistics in place to test. If we find ourselves in an orange zone and we have to test everybody to come back, it may take longer. I cannot tell you until we get into that. But every single person who comes back in person would have to have a negative test before they come back in the building. Those are the rules as defined by the guidelines, by the DOH. And that's where I got in that conversation. If we find ourselves in a situation where 30%, 40% of our students don't consent, then we can't shift 30 or 40% of our students to fully remote and continue to offer in person. But we can't logistically do that. We don't have the means. And so that's going to be a really sticky situation, a touchy situation, because we'll have to ask for that consent first, right? And we'll have to open up their testing locations because it'll be all drive-up testing, or you'll have to go somewhere to get the test. And then we'll have to analyze the numbers and make a decision as to whether or not we can open, and return. And any staff that return to work after 4 days has to be tested, okay? Right, Mr. Brennan? I don't think, as far as essential staff, I don't even think you and I are considered essential anymore, are we?
I believe it's an example of all means all. I think we all have to get tested then.
Yeah, so, okay. Do you know what the rate of false positives is? I do not, but we're ready to manage those as described. Will the whole district close for positive cases, or will just the school affected close if necessary? Also, where is the COVID testing taking place in the buildings? Is it in the nurse's office where there might already be other sick students? Will the whole district close for positive cases? No. If there's a positive case, again, they'll be discreetly isolated in our COVID-19 isolation room. We currently have those. We're mandated to have those in our building. And then that person will be referred to their healthcare provider or clinic. And then basically, we're asked to notify Monroe County Public Health Department, which is the current protocol and practices. Then they get involved in the contact tracing. And so really the contact tracing will determine to what degree the school's impacted. And so far, thanks to the safeguards and the daily practices of our students and staff, we've only had to quarantine one classroom so far this year. That's fabulous. And they haven't considered, since that quarantine, we haven't had any close contacts in school. And they weren't even sure of that one. They just did it out of an abundance of caution. So James, anything you want to add to that?
No, I think you hit it all. I mean, really, the impact in terms of the building is really controlled by the Monroe County Health Department and the contact tracing they engage in terms of what they find. What we need to do next will come from their guidance.
Next question, I think we asked it or answered. It's about if a child can still be part of the hybrid model, or do they have to go remote if they don't opt out? And I think we hit that. If we do the drive-through, will we know that night of the results? Dan, take it away.
Mind if I take that one and say, yes, you will know the results that night. We are currently planning, if there is any positive result, you'll be called within an hour from the time you take the test. No response means negative, but you'll be called within an hour based on the phone number that you provide when you take the exam. If I can go back to a previous question for just a second too.
Take it away.
Asked, where will COVID testing be taking place in the buildings? Is it in the nurse's office where there might already be other sick students?
Thank you.
Just wanted to hit that quickly. The location varies by building depending on rooms that we have available, and we've gotten a little creative here. But the goal is to not have most of that testing being taken in the standard health office. Conference rooms, flex spaces and basements, gymnasiums, career center, principals conference rooms, trying to move that away from the nurse's office so we don't have a interference of our already ongoing health office work.
Thanks, Dan. And I'll just note that the flex space in a basement is not a, it's not some basement where it's, dripping wet and everything like that with mice running around. This is like in Rogers, we have classrooms in our basement and then Seneca School and things like that. So these are fully outfitted portions of our school that we're not going to be sending kids to the depths of the basement.
You're not going to the boiler room.
You got it. A good way to put it. So the next question I'll hit, because I made this decision. What is the reason for releasing results one time per week rather than real time? So, this was a conversation we had regionally with the superintendents. And honestly, we've gotten to the point where, we haven't had an alarming, in my opinion, we have not had an alarming number of positive cases in the district. James, what are we up to now, total since September? 30?
30 is correct.
30, right? And so that's since September, okay? So what we know and what we trust at this point is the public health department's doing a fantastic job of contact tracing, okay? We also participate in that contact tracing. By sending you an email, which was becoming every day, it becomes this unnecessary disruption to you folks, and it's kind of getting watered down. So honestly, in that, I know that people enjoy knowing that, but there really isn't a utility in that because it isn't adding any additional level of safety or compromising your safety, because anybody that needs to know is contacted directly. And the public health department, when they go through that contact tracing, if they felt like there was any issue or anybody's safety was compromised, they would either quarantine additional individuals or quarantine a class like they have. Okay, so that's why we made that decision. And really, it's to streamline the communication for you folks, our families at home. But again, if you ever have any questions, if you hear hearsay in the community, just give us a call. We'll share what we can, again, respecting the privacy of those individuals. If you hear that there was a positive case in your child's school and you're just curious and it's not Wednesday, call the principal, okay? And we'll share what we know. Other districts are providing advance notice. I'm sure there are some that are doing that. Again, this was a decision that we made internally, and a bit of it is just the logistics and the communication and being able to provide that advance notice. And the other thing is, quite frankly, helping, from our point of view, manage some of the anxieties with our students. So if we contact you and you inform that student, depending on their age, they may have to go to bed and sleep all night thinking about that test the next day and what they've heard, come into school anxious about that. And for some of our schools or some of our students, school anxiety is a real thing. And so we made that decision. And, but if there's any questions about that, feel free to either reach out to me or your child's principal. When will we find out if a child or children is chosen so we can arrange drive up if possible? So again, you won't know. We're inviting people to sign up so that you can you can choose to do that if you're consenting, whether you were chosen or not. And then we're going to take those numbers, and that's just going to reduce the numbers that we have to randomly select at each building. Okay. So you won't be notified that you have to come for the remote, but we're giving you that option so that you can get ahead of it, take advantage of that. For some people, honestly, it's a free test. Heading into Thanksgiving, for some folks, some families I talk to, they want to take advantage of that because they just want to know, right? Otherwise, they got to go pay for it and wait time. And so we're inviting grades K through 6 to do that. Our 7-8 students are allowed to do the drive-up testing as well. It's currently not designed for that, but like I said, if you have a family with K through 6 students and you happen to have your grade 7 or 8 child come along, I think we can work them in. How will this entire process be addressed in classrooms? Will students be learning about the science behind it, perhaps? That's a really good point, a teachable moment. I'm going to put Chrissy on the spot.
Yeah, figured it was coming my way. Well, I certainly think, if I look at this entire situation and what our teachers have been able to do, they've shown no shortage of creativity and also seizing the moment. So I know our teachers will work hard to best be able to communicate to students the situation that we're all in, and I think we've addressed a lot of that too through our social and emotional learning. But certainly, I think this poses a lot of great different opportunities, and I think that our teachers will look at the appropriateness per grade level, and they may take advantage of that teachable moment, as we're always reaching for those as possible. But certainly, it's not just those kind of scientific teachable moments, but I do think, like I mentioned, there's a lot that we've already done to wrap into our social emotional learning through our morning meetings, different circle opportunities, in order to support our students, knowing that there is not just things to learn, but some anxiety with it. So, our student services staff, just to touch on some of the questions that were already asked, they've been doing a great job to help our students navigate through some of the anxiety of the different feelings they've had around just COVID-19, and they'll continue to do that for testing as well. So, our counselors, psychs, social workers, they've all been heavily involved in each step of this, and they'll continue to support our students as needed.
Thanks, Chrissy. And I would just add this, right now, we haven't stopped to consider what instructional applications this might have. But that is something that it does present a teachable moment. And, maybe we might get to a point where there's vaccinations for this. And this could be like in a science lab, something that they do around testing. I don't know. I mean, I'm just throwing things like that out there. The next question is, will parents be made aware of positive test cases in their child's classroom? The answer is no. We don't currently do that. And the reason why is we don't want to stigmatize students. And for the exact reason that somebody brought up before, if a student is not there and we announce that there's a positive test in that classroom, then it's very easy for the people to make assumptions and pinpoint who that positive test is. And we're not allowed to do that based on student privacy laws. Dan, anything to add to that? If a student tests positive at school, what does she need to do in order to return? James?
Yeah, it follows a lot of our same protocols we follow if a student were to present with COVID-like symptoms while they're at school. They obviously would go home. They would be advised to see their healthcare provider, and the healthcare provider would engage in further investigation in terms of the any other symptoms besides the diagnostic positive test that they had, and very likely they would be requested by their healthcare provider to get the more standard test for COVID-19. It's, obviously it's a swab that goes further into their nasal cavity to get a better sample at that point to either confirm or refute what the diagnostic tests that occurred in school showed. And basically next steps would probably be ultimately determined by the results of that test.
So if we are planning to participate in the drive-through testing, do we still need a consent by 10 a.m. tomorrow? We would appreciate it if you did, so that we know and we have that group of consenting students. If you're not able to get that in, you show up and you provide verbal consent. Mr. Fullerton, can we manage a small number of those?
Absolutely.
Okay. Is the drive-up testing voluntary, or will parents know in advance? Again, it's voluntary because we're not issuing notice to parents ahead of time. So that's just giving people an opportunity if they want to be proactive. So we're just offering that up. If we go into the orange or red zone, was it stated that every student or staff going in person will need to test negative to return? Yes, that's the guideline. Everybody has to test negative before they return to school. If so, would it be done at school doing a rapid test or a at primary care, PCP care. Either is my understanding, and so we would be doing some type of drive-up testing here at our location is my current assumption and understanding, or you could go to your primary healthcare provider. Where in the building is the testing happening? I think we hit that. If we have to keep testing after the first week, won't the same students have to be tested more if there are a number of students that have opted out? Potentially, and before we knew about this new change, our superintendent's group asked Dr. Mendoza that, and his direction to us was, the public health department, was that, if we get to that fourth week, if we can get through to the fourth week and we have maybe 15 or 20% of our students who do not consent, then he was going to approach the New York State DOH on wrapping back around, because I think we all agreed that it served the intent. And so I'm optimistic about that, but that's not currently the case. Will remote students go play sports? Will remote students who play sports be included in testing if they consent? Yes. So we had the conversation around that. Any remote students who are participating in sports or who participate in extracurriculars, they are part of that in-person pool and subject to the random testing if they consent. So a great question right there. I believe the state guidelines say that we will be made orange when we've sustained 4+ rolling average for 10 days. So in theory, that will be this Thursday. So I'm curious about testing procedures if we're orange. Is it still 25% of our school population each week? That's my understanding currently. Different people each week until everyone is tested. Theoretically, like I said, yes, although there is some optimistic hope there given to us from the Monroe County Public Health Department. Or has that changed? None of that has changed at this point. So a good point of clarification. I'm not sure that I relayed that it is actually orange or red. It's elevated to 25% instead of 20%. It's a really good point. Correction on remote students who play, not go. Sports be included in testing if they consent. Yeah, right? If I'm understanding that correct? Yeah. What if my child's classroom teacher or staff chooses to not take the test? Yeah, we're asking for volunteers right now. Eventually, if we become an orange or red zone, then we'll be in conversation with our staff to encourage everyone to comply with that testing, if that's the mandate. But again, we're going to cross that bridge when we get to it, which could, as somebody pointed out, potentially be this Thursday. If students test negative prior to a possible shutdown, will that test be counted as a negative test? Not necessarily. My understanding is that it has to be within 7 days, correct, James? Yeah, of when the designation is made. You said that this is surveillance testing and that positive tests should be followed up with more invasive diagnostic testing. What does that mean for contact tracing? Will people who get positive tests at school be subject to contact tracing? So yeah, people who test positive at school will be referred to their healthcare provider. We report those individuals to the public health department. They go to have that follow-up test with their healthcare provider, right? And then the public health department will start to contact trace that. I can't say how they verify the tests. I don't know. I just know that that is what we've been encouraged to do when we encounter positive tests. But yes, when we contact that public health department, they will start the contact tracing on that. Has there been guidance given for the parents to be able to administer these tests ourselves at home? No, there hasn't been, because they have to be administered under what's called a limited service laboratory, which we've applied for that certification. And currently, schools in Monroe County are operating under the certification of Monroe County for the short term. So no, we cannot give these out and have people take them home to administer them. Not sure if this was addressed, what type of COVID test will be needed to return to in-person learning if we go orange or red. So again, that would be either the drive up here at school with the, what are they, Binax Now rapid tests, or you can go to your healthcare provider.
Correct. That's the ones we use, the Binax Now rapid tests.
Will these rapid tests be sent to local pediatricians to use as well? My understanding is that anybody could have contacted the state, right, James? Healthcare providers, clinics, I think even pharmacies. Is that correct?
Yeah, I mean, I think Dr. Mendoza, one of the videos I saw, he was talking about that a little bit. He said, you know, they're kind of starting them with schools right now as part of the rapid testing, but I believe there's availability of them beyond that.
So I think we answered the next step, our next question. Will you be notified if you're selected for Wednesdays, or is it just open? It's open for students with consent. How does Wednesday evening work if students are not selected until right before they're tested? Again, anybody can drive up. So we'll just be drawing those numbers off from what we have to select randomly. If the area shifts to an orange zone in the midst of testing, will the school be required to close, or will it be dependent on the rate of positive testing results? My understanding is that as soon as we are designated orange, we have to go fully remote. James, concur? Do we still do the drive-up option even if we don't provide consent? Well, if you haven't provided consent and you choose to drive up, you will have to consent for your child on location. So you do. We would ask that you consent prior, just so we know how many people are consenting. But if you drive up and consent there, we can test your child. Will there be a cap, either a time limit or number of tests on Wednesday, if many families are interested? Mr. Fullerton.
That's quite the question, as we've never done this before, and we are trying to staff this to the best of our ability. So this is all new to us. But our plan is to, much like we did with our laptop program over the summer, to try and set up 2 windows at the bus loop at South Lawn Rogers with roughly 8 folks at each window that allows for 3 testing teams per each window. Planning on running this from 5 to 6 for K3 and 6 to 7 for students in grades 4 through 6. I would assume that if we have a few folks a little bit after 7, we'll probably try and clean up any cars that are there, but really we're going to be limited to this time window based on respecting the time of our volunteers and testers to the best of our ability, and making up the rest of the tests in school on Thursday and Friday.
So like many things, the second time we do it, we'll be much better at it. So we're going to do our best this first time through. And that's another reason why we're doing it, honestly, is to work out some of those bugs. So if we close 100%, the 100% test, is it rapid test or deep nasal? So we're going to offer the rapid test here for drive up, and then you can go to your healthcare provider if you choose to receive alternate tests, which could be the deep nasal, and submit those back. If my children are tested at the PCP and we are in the orange zone, will that negative test be allowed to prevent them from being tested at school? Yes, you just have to give us documentation. And you could do that now. If a student tests positive with the rapid test, but then tests negative with the more standard tests, can he or she return to school? James, there's protocols for that, correct?
Yeah, the deep nasal, they consider the gold standard. So that would be the one that obviously the protocol is with the negative test, and then information from your healthcare provider, they could return to school.
Oops, you're on Zoom, or on mute, Dr. Johnson.
Boom. Where can I get a copy of the consent form? I can't find it on the school district website. Dan?
I would recommend emailing or calling our Office of Public Information. They come in tomorrow morning around 8 a.m. and I think they can get you a link to the Microsoft form where we have that consent, or an alternate paper copy if that's more convenient.
Yeah, that was my understanding. That was sent directly to parents, and we didn't post it because we didn't want that to be publicly accessible, freely accessible. So just please contact our public information director, Jeffrey DeVeronica. You can find his email on our web. If county goes to orange or red and schools close, do schools stay closed until out of orange or red? Can schools open sooner? Yes, we can open sooner. Again, we have to go fully remote at least 4 days. Then we have to test 100% of our people. They have to be negative before they come back. And then we have to continue to test 25% every week thereafter to stay open. Can we provide a one-time consent rather than consent through June? Yes, absolutely. And so we'll have to go back, and right now we were addressing the current situation. And I don't know off the top of my head, do one of you guys know our current consent form? I don't think it.
The consent form itself indicates that you're consenting for perhaps multiple tests.
Okay.
So it does cover it.
Yeah, just so you know, Mr. Brennan did take that consent form and run it through our legal team just to make sure that we had all the checks and balances there for folks. So yeah, that's good. Thanks, James. If we reach orange Thursday, will hybrid kids then go to school Friday, be to school by remote? Yes, theoretically. And Chrissy, you want to talk about that? You've been working hard to make sure that our staff are prepared, along with Karen.
Yeah. Yeah, so if we were to move to remote instruction, our teachers are prepared and preparing for instruction to continue. Like we said, we're going to try to stay as close to in-person instruction as we can, but knowing that obviously moving to remote, there'll be some things that we'll need to adjust and make happen in that type of environment. But yep, we'll be ready to move to that type of learning environment if needed.
So I've got two people with their hands up. I'm going to run through the last few questions, and I'll get to you with your hands up. If we reach, so we answered that one. If a test comes back positive, will staff wait to tell the child until the parent is present? If not, will they be, and then it got cut off. So yeah, this is where we would discreetly call a student down to the nurse's office, and the nurse would inform them privately of that there. And we have the COVID isolation room in each of our buildings where that student would be located, and they contact the parent there. Anything to add? Okay. Well, no more hands up. So I think must be we addressed those questions. And I'm going to just quickly take a look at the chat. There's 5 questions in the chat. So can you explain, if a school has no COVID cases, will the school be closed even if the district has to close other schools in the district? Can you explain, if a school has no COVID cases, will the school be closed even? Yeah. And so it depends on the zone. If all of our schools currently right now fall within the yellow zone. So if we're elevated to an orange or a red, that's going to include all of our schools. There's other school districts where they have some buildings in the zone and some out, but that's not us. The other scenario is if through contact tracing, they've determined that there has been exposure or transmission or maybe a cluster inside of that building, then the public health department, in collaboration with us, could choose to close a building or close a classroom. Where is the testing location? I think we covered that. I'm comfortable bringing my children to the drive-through, but not comfortable with them testing in school. Can I bring them to the drive-through, but not give consent to the in-school testing? Sure, that's fine. Is the test will be taken normally through nostril? I was told it would be swab in the mouth for children. Yeah, we didn't know. I think initially we were wondering if it was the mouth or nasal, and they did end up being the nasal. So these will have to be a shallow swab in both nostrils. And that's it.
We do have 2 attendees with hands up now, Dr. Johnson.
Okay. Let me find them. Okay, there we go. Okay, Anne Marie, I'm gonna, there you go, bringing you in, Anne Marie.
Hi, everyone.
Hi, Anne Marie.
Thank you for doing this. I appreciate it. Just a couple quick questions. So if we do go fully remote, I know it's up to teachers' discretion and academic freedom how children are taught. Are you requiring live Zoom instruction? Are you requiring, how is that going to look for the remote instruction? My children are both hybrid, so I'm just trying to envision what that will look like for my girls. And also my other question was, with the orange zone, I'm noticing, because we're all in 14617 zip code, so that was my question about if one school has a predominant amount of cases and another school in the district does not have any cases, will they just close one school, but they close by the zip code? Is that correct?
That's correct.
Okay.
So you just made Chrissy Miga's night, because she is fully prepared, has been working with our staff to answer that question. So Chrissy, go ahead.
Oh, good. Hi, Chrissy.
Hi. So yeah, so at the K-6 level, well, first I'll start with that, as part of our reopening plans and guidance from New York State, we needed to have a plan for substantial interaction with students, whether in a hybrid or remote setting. And so at the K-6 level, our teachers have been working over a couple different meetings and are currently working now to create their schedules of what remote learning would look like. There will certainly be more Zoom or synchronous, as we say, interaction than some of the instances in the fall. And so they're working right now in grade level teams, and then they're going to work across grade level buildings to ensure that consistency. And so it will still be a mix of synchronous and asynchronous, but it will really mirror that in-person instruction. So some whole group mini lessons and then some small group work as well, and a mixture of that throughout the day. So it's really what the students are experiencing in person to the best of their ability, they'll recreate that in some ways in a virtual world. And for 7-12, the teachers again have been preparing to move to an all remote environment and minimally getting that synchronous instruction to match what they currently have. So on the in-person days that they are going, they would get the synchronous instruction there on those days following their regular schedule. And so, yes, there is always going to be teacher autonomy. It's what makes teaching great and individualized to student needs. But certainly we have been planning, at a district building classroom teacher level to have that substantial interaction, which we call synchronous or via Zoom or the Teams instruction, again, with that mix of the asynchronous.
Okay, am I still on?
Yep.
You are.
One more question. The younger children, my daughters are older, but just thinking about other friends that I have in the district, are the younger children K-3 per se? Do they have Chromebooks or anything at their fingertips, or will there be curbside pickup for supplies? I'm just trying to envision what's this going to look like.
Yeah, so, and Dan, I see you coming on too, so you can jump in at any point, but Dan was going to jump on because his tech team has done an amazing job to ensure that at the start of the school year, our students K-12 have one-to-one devices. So all of our students already have and had since the beginning of this school year their laptops that they have been bringing to and from school so that they could be prepared. In addition, we have had some materials that we know could be sent home in order to support at-home learning that we don't necessarily need at this moment for in-person instruction. And some of those materials have already been sent home, again, in an overabundance of caution, but we can still continue teaching just as we have with in-person. So we've already taken a lot of those precautions to help prepare, and our students are prepared as well as far as devices. Dan, anything to add? Or
Well put. Thank you.
Thank you. I know other districts aren't in the same boat as you, so I appreciate it.
Thanks.
Yeah, we have a great team that had put that plan in motion, what, Dan, 2 years ago?
It's been going for a little bit now. Yes, sir.
Okay, maybe longer than that. But that's how long I've been here. So
Thank you.
you're welcome. Thank you for joining us tonight. And the last thing I would just note about, the devices at the lower grades, we had some feedback about the interactivity of some of those devices and why those weren't tablets. And we didn't plan to pass those out at the beginning of the year. Well, actually, we did at the beginning of the year, but last year. And so we did the best that we could with what we have. But moving forward, we now realize, right, Dan, you can chime in, that we want to make sure that the devices we put in the hands of our younger learners do have that tablet interactive capability. Is that right?
A significant majority of them have the touchscreen capability. Unfortunately, not every device in the hands of our students does at this time, but we are trying to prioritize that to the best of our ability and availability of devices. Lead times are mighty long at the moment.
Yep, that'll be something we work on moving forward. So I think we got one more question that came in, and then maybe there was a few more.
We have a question. I believe you said if we go remote due to orange red zone, 100% of folks need to test negative to return. Is that including students getting tested or just staff?
Students and staff. Are kids mandated to join Zoom classes during the day or at the parents' access for those of us who work days?
Yeah, we are asking that to the best of students' abilities that they're able to join the synchronous Zoom instruction. And we have tried to make that as easy and accessible for all of our learners as possible. And that was shifting to those learning management systems of Schoology, which we've been at now at grades 4 through 12. And this year to Seesaw for our youngest learners. And so we've been working hard to create systems in which the students sign into those learning management systems and then very easily are able to access the links in order to get onto the Zooms. And in addition, we have, for our younger learners who might not be as independent, we have had teachers already practicing getting onto those learning management systems, even in a hybrid model. So even though they're in school 4 days a week, they have been practicing getting onto Seesaw. Teachers walk them through those steps and we will have guidance. So we realize that in any shift to remote, we'll have to continue to work with students, but we are trying to create an environment in which we know that parents will have busy schedules themselves. So what can we do to create something where students can join us independently?
And let's just, let's shoot one another straight here. If we go fully remote, we know that being able to replicate what we do in person, face-to-face with students, we just cannot do in a 100% remote model. We're doing our best with the people that chose that now, but when people have made a choice to do that, I would tell them as a superintendent, they're making a choice. There's going to be a difference that we just can't replicate. And if we're forced into a fully remote model for our children, there's going to be some consequences to that because we understand that everybody's, in a different spot. And we're going to do our best to meet people where they're at. But that's going to be a real additional lift for everybody involved, families and school. So that's why I say it like a broken record. And it's not meant to be demeaning or threatening in any way, but anything we can do right now to prevent that type of scenario, I think we would all stand up and cheer for that. And so that's, carrying these safety protocols, precautions over outside of school. If you're having gatherings, limit them. If you're getting together, make sure you're masked, physically distanced. Because when we do that, you're really jeopardizing our ability to sustain this. And then we got to drive those numbers down, folks. We got to drive those positivity rates down, which leads me to the last question, which was somebody kept hearing Thursday. Is that the cutoff to determine an orange zone? No, that's the first day when it can be designated, because it's got to be 10 days of sustained 7-day rolling average of 4% or more, correct? James, right? Yeah.
Yeah, that's my understanding too.
Yeah.
It's just whether or not it will be declared. That's the question.
Yeah. All right, folks. Well, I appreciate everybody's attendance. I think we got through all the questions. Dan, James, Chrissy, we've never done this before, but a virtual high five to you guys. There you go. Bam, back at you. I appreciate your time. For our attendees, we have one last hand up. I'm going to hit that before we sign off. Lorraine, welcome.
No, I was giving you a high five.
Oh, I love it. Thanks, Lorraine.
Thank
All
you.
right, folks. You guys have a great night. And if anything pops up, please call your child's principal or contact one of us directly. You guys take care. Thank you.